All right, good morning, everyone. Welcome and thank you to those joining us for the first time, and welcome back to those who attended our other presentations in our workshop series. I'm excited to be here. I'm going to talk about our foodborne outbreaks and the lessons learned for our 2020 and 2021 outbreaks. And as Susan said, if you have any questions throughout the presentation, just throw it in the chat, and we'll address some of them at the end of the presentation. Get started. All right, so a little bit about food safety in our state. We have 39 counties with 35 local health jurisdictions. We are a decentralized state, so that means that each health jurisdiction has local control over their jurisdiction. So at the local level, our local health jurisdictions have their individual food safety programs where they inspect retail food establishments, they investigate outbreaks, and then they report outbreaks to the state. And then at the state level, we develop and interpret the food code. We'll train, advise, and assist our local partners. And we also lead outbreak investigations when they're multi-county. We'll work with CDC to investigate outbreaks when we are included in a multi-state outbreak, and we report outbreaks to the CDC. So our mission is to prevent and reduce the incidence of foodborne illness in the state. And our vision is to inspire others to excel. And we're a progressive team that continuously improves food safety because we collect, analyze, and use our outbreak data, especially by sharing these outbreak stories to teach and train in preventing foodborne illnesses in Washington. So what is foodborne illness or a foodborne disease? So foodborne disease is an illness that results after consuming contaminated food. So foods can be contaminated by microorganisms such as bacteria, viruses, parasites, but foods can also be contaminated by chemicals and toxins from the environment as well. The biggest takeaway is that foodborne disease is preventable. So CDC estimates that each year, roughly 1 in 6 Americans, or 48 million people, get sick. 128,000 are hospitalized and 3,000 die from foodborne diseases. Here are those numbers for Washington. So 960,000 illnesses, 2,560 hospitalizations, and 60 deaths. And foodborne disease can have a huge impact on our community. The CDC estimates that $15.6 billion are in related costs. And this is really only the estimated burden of disease. So to explain the true burden of disease, we like to use this iceberg picture, excuse me, where the true number of ill people are at the bottom of the iceberg. Only a portion of those people will visit their healthcare provider. A smaller portion will get a clinical lab test. And then if it's positive and reportable, then it is reported to the local health departments, to the state health department, and then to CDC. So what's reported may only be the tip of the iceberg, right? It's estimated that for every one salmonellosis case that is laboratory confirmed and reported, there are 29.3 cases of salmonellosis that go underreported. So factors that can lead to underreporting could be because that ill person does not seek medical care, their healthcare provider does not order a clinical test, or test results are not reported to public health officials. So the true burden of disease is underestimated. So as we know, our world is surrounded by microorganisms, right? And most are naturally occurring and most are good. However, there are bad microorganisms that cause illnesses, and that's what we call pathogens. So a pathogen is a bacteria, a virus, or a parasite that can cause disease. However, chemicals and toxins can also cause foodborne illnesses. So simply meaning disease or illness causing agent for our chemicals and their category. These are the top 5 pathogens ranked highest to lowest in each group that causes the most foodborne illnesses, hospitalizations, and deaths each year. Remember, foodborne disease is preventable. So when we aim to prevent illnesses from even happening, we can also prevent the hospitalizations and deaths. And then these are just some common symptoms of foodborne illness. So we have our nausea, vomiting, diarrhea, cramps, headache, fever, chills, body aches. These symptoms are typically resolved in a short time and most likely mild. So going back to our iceberg picture, this is why most people don't visit their healthcare provider, because these symptoms can be short-lived and sometimes tolerable. So again, the underreporting of foodborne illnesses. However, complications can happen from our foodborne pathogens, and these are just a few examples of complications. I do want to touch on this one here highlighted. It's hemolytic uremic syndrome, or HUS. It'll come up later in the presentation. So hemolytic uremic syndrome, or HUS, is associated with Shiga toxin producing E. coli, or STEC, or STEC for short. I feel like it has a lot of nicknames. So HUS occurs when your kidneys become damaged, and it can lead to kidney failure. About 5 to 10% of people diagnosed with STEC infection, so Shiga toxin producing E. coli infection, develop this life-threatening complication. Anyone with an STEC infection can develop HUS, but it is more common in young children. And most people with HUS recover within a few weeks, but some have suffered permanent damage and some have died from it. So again, when we aim to prevent foodborne illnesses, we can prevent these complications and the hospitalizations and deaths. So anyone can get foodborne illness, but there are certain groups of people who are more likely to get sick and have a more serious illness. Their body's ability to fight pathogens is not as strong or not as effective for a variety of reasons. So we have our infants and children and pregnant women, we have our elderly, we have people who are on certain medications and those who are immunocompromised. And this also includes people getting food from service institutions such as healthcare, assisted living, or like custodial care facilities. So these are highly susceptible populations who are more likely to get sick and have a more serious illness. All right, let's start going into our outbreaks a little bit. So this graph here shows our foodborne illness outbreaks by year in Washington from 2010 to 2012, or sorry, 2021. And so a foodborne disease outbreak occurs when 2 or more people experience a similar illness after consuming common food. So most of these here are, I guess you can say, quote unquote, small outbreaks that may only have 2 to 3 people. However, small outbreaks add up to many outbreaks reported yearly, and sometimes outbreaks are not small. So here we have the same graph with cases overlaid. So quickly pointing out that spike in 2017, we had about 30 outbreaks associated with raw oysters with roughly 110 cases. And then we had a norovirus outbreak that had 550 cases. So the size of a foodborne outbreak can vary based on which pathogen is in the contaminated food, how much food is contaminated, where food is contaminated, where the food is served, and how many people eat it. So it really depends on a variety of these factors here. Looking at 2020 and 2021, in 2020, we had 11 multi-state outbreaks reported with 205 Washington cases who were affected. One outbreak in particular was the Salmonella Newport onions outbreak. In the US, there were over 1,000 cases. In Washington, we had 150 cases who were affected by this. In 2020, we had 10 Washington outbreaks reported with 177 cases. But going on to 2021, we had 9 multi-state outbreaks reported with 50 Washington cases and 20 Washington outbreaks reported with 306 cases. So I do want to emphasize that these are outbreaks that have been reported. So remember, our LHJs, or our local health jurisdictions, they investigate and report outbreaks to the state. So our data here is only what is reported to us. So we can guess that outbreaks that have happened in the past 2 years may have been underreported or unreported based on many factors, especially with case counts as well, especially because of the burden of the pandemic, right? So we know businesses were closed across the state. People didn't eat out or ate out less. But more importantly, like visiting healthcare providers was viewed differently as people were more concerned with COVID and respiratory symptoms than diarrhea or gastrointestinal symptoms. We know our healthcare facilities were full of COVID patients. The public health focus in laboratory testing shifted to prioritize COVID. So there may have been many unofficial factors that have contributed to lower reporting of cases and outbreaks in our last 2 years. So here we have a map of where our Washington cases were from that were part of the 11 multi-state outbreaks that were reported in 2020. And so with multi-state outbreaks, this is when products are contaminated at the source or during production that is then distributed to customers. So an example of that would be contaminated produce from a farm that is then shipped to grocery stores nationwide. So again, for our multi-state outbreaks in 2020, we had 11 with 205 Washington cases, and these are where those cases were from. And then this is a slightly, excuse me, hold on. I had a cough there. So this map here is to show the jurisdictions who reported outbreaks in 2020. So this is slightly different from the previous map. So this is just where outbreaks were reported. Again, our local health jurisdictions report those outbreaks to us. We had 10 Washington outbreaks reported in 2020. Here are the outbreaks by pathogen in 2020. Most of our bacterial outbreaks reported were included in multi-state outbreaks that year. We had 3 viral outbreaks reported in 2020. We had 2 norovirus and 1 hepatitis A outbreak, which is surprising because typically we see more viral, more specifically norovirus outbreaks reported. And this could be because of the pandemic as well, with everyone staying home, washing hands more frequently, cleaning and sanitizing. I will share some short outbreak stories for a few of these pathogens in a few short slides. Okay, so in 2021, here's a map of where our Washington cases were from for the 9 multi-state outbreaks reported. So we had 50 Washington cases, and this is where they're from.
Thank you.
And then this map, slightly different again. This is just to show the jurisdictions who reported outbreaks in 2021. And we had 20 Washington outbreaks reported. And then here are our pathogens for 2021 that is reported. I do want to make a note, the very last bullet at the bottom under the chemicals/other category, it says VP or norovirus. I do want to point out that VP stands for Vibrio perihemolyticus. That is a bacteria, and norovirus is a virus. And so with this outbreak, there was no clinical lab tests to confirm the pathogen. However, the symptomology of the cases fell right between Vibrio or Noro, and the foods associated were oysters. So this one, we weren't able to confirm the pathogen, but it fit both Vibrio or Noro, but it's under the other category. However, Vibrio is a bacteria and norovirus is a virus. I'll touch on this a little bit later. Okay, I'm going to talk briefly about what contributing factors are, because contributing factors are necessary for us to identify in our outbreak investigations, not only to stop the current outbreak from happening longer and making more people sick, but to learn from the contributing factors of that outbreak to prevent future outbreaks. So what are contributing factors? Contributing factors are the preventable causes of outbreaks. These are food preparation practices, behaviors, and environmental conditions that lead to pathogens getting into food or growing in the food, which can cause foodborne illnesses. And then with our outbreak investigations, the environmental assessment piece is an important part of our outbreak investigation. So an environmental assessment really is a systematic approach in determining how and why pathogens got into that environment and spread to make people ill with food as a vehicle. So identifying contributing factors in foodborne illness outbreaks is really key to stopping them and then learning from them and preventing them in the future. So we have CDC has 30 contributing factors for foodborne illness outbreaks, and they're organized in these 3 categories. So for our contamination factors, these really relate to how pathogens or other hazards get into the food. So for example, a sick food worker handling food with their bare hands. For our proliferation factors, these are really for our bacterial outbreaks, but these factors relate to how bacterial pathogens were able to increase in numbers and or produce toxins prior to the food being consumed. So an example of this would be foods that have been refrigerated in large quantities or like large volumes of food in containers, which does not allow proper cooling. So that leads to the proliferation of the bacteria. So the bacteria growing due to improper cooling. For our survival factors, these are primarily bacterial outbreaks, but for our survival factors, this really refers to pathogens surviving a process that is intended to kill or reduce them. So this would be foods that are not cooked long enough or to a hot enough temperature. The most common contributing factors for outbreaks in restaurants come from our sick workers and food handling practices. And outbreaks can have one or multiple contributing factors. So here are the top contributing factors that were reported for our 2020 outbreaks. We're seeing a contaminated raw product, which was food intended to be consumed after a kill step. So this would be our raw chicken because it's intended to be consumed after a cooking step. So we had that one come up as number 1 for our 2020 factors reported. Excuse me. We also had lack of hand washing. For this example, an outbreak who reported this contributing factor. It was an ill food volunteer. I believe it was at a fundraising event, but an ill food volunteer vomited in the bathroom and then came back into the kitchen without proper hand washing. And so they were preparing peanut butter and jelly sandwiches for this fundraising event. Lack of sanitization really means like inadequate cleaning or sanitizing. So we'll see that with our most of our outbreaks. Insufficient time and or temperature control during initial cooking or the heating process. So we had a couple outbreaks who reported this where raw chicken, of course, it's intended to be consumed after a cooked step. However, this chicken was not cooked to the required temperature, and this happened at actually a quick service restaurant. And then coming in as number 5 as a tie there, we have a bare hand or gloved hand contact by a food worker who is suspected to be infectious. So with our bare hand contributing factor there, it goes back to that ill food worker or ill food volunteer at that fundraising event who vomited without proper hand washing, but they prepared those peanut butter and jelly sandwiches with their bare hands. And then for our gloved hand contact, one outbreak that reported this was, it was at a long-term care facility, and food workers were preparing food while they were symptomatic. So this is what we had for our top 5 contributing factors. Again, outbreaks can have one contributing factor or multiple. In our 2021 outbreaks, we see that lack of sanitization bumped up there as a top contributing factor. In that, we also had contamination by a food worker who is suspected to be infectious. This contributing factor is slightly different from our gloved hand or bare hand contact contributing factor. This one is really when it's unable to be determined whether it was through actual bare hand contact or glove hand contact. So this is a slightly different one where it's still contamination from a suspected food worker, but it's undetermined if it was bare hand or glove hand. So it could be through even tongs or utensils and things like that. And then we had glove hand contact by a suspected infectious food worker. We had raw product that is intended to be consumed raw. So this is really related to our leafy green outbreaks or our produce outbreaks. And then we are seeing improper and slow cooling. So this is related to our bacterial toxins. So our Bacillus cereus or our Clostridium perfringens, where foods are improperly cooled, which allows the proliferation of the bacteria. And typically for our contributing factors, we see contamination as the most reported factors for our outbreaks. Okay, so I'm going to get into some short stories for our outbreaks by pathogen. Okay, so we had a hepatitis A outbreak in 2020, and this outbreak occurred while there was an ongoing local outbreak of hepatitis A among people experiencing homelessness. During this time, many facilities in the community were closed due to COVID. So no indoor dining or dining rooms were closed, bathrooms were closed, things like that. So this facility in particular still allowed the public to use restrooms, and this facility contracted with an outside cleaning company to come clean their restrooms. So it was under the responsibility of this outside cleaning company to clean their restrooms and not the food employees of that establishment. However, with the contracted facility or the contracted company, they actually came 1 to 2 times a month. So during the environmental assessment, improper hand washing was identified. So with the lack of sanitization of the restrooms and improper inadequate hand washing, the pathogen was transmitted from surfaces in the bathroom on hands of our food workers and onto the food. there were 5 cases in this outbreak, and these 5 cases are not people experiencing homelessness, and they did not have connection to people experiencing homelessness. However, through whole genome sequencing, these 5 cases were linked to that local hepatitis A outbreak. So as a result of this investigation, the establishment was closed and a public notification was issued. There was a behavior change, procedure change, and cleaning and sanitizing of the facility that was required for the establishment to reopen. So this one here with our contributing factors, that's why the ill non-food worker was listed as a contributing factor. Okay, for our norovirus outbreaks, we had 13 that was reported in 2020 and 2021. So there were 2 in 2020 and 11 in 2021. And so the top contributing factors are typically ill food workers, improper glove use, and lack of sanitization. And we'll also see improper, inadequate hand washing as well as a contributing factor for our norovirus outbreaks. We always see a variety of ready-to-eat foods because these food items do not have a kill step or a cooking step that would kill the virus. And we also see raw oysters that have been associated with norovirus outbreaks. I do want to make a note to the piece on the fried part on the oysters listed there. So this was the outbreak I was mentioning earlier that it could be either Vibrio or Noro. Again, there were no clinical lab tests from the cases, so we were unable to confirm the pathogen. However, their symptoms, incubation duration, foods consumed matched either Vibrio or Noro. So for this outbreak, during the environmental assessment, the establishment was not cooking the fried oysters to proper temperatures. So the final cook temperatures actually ranged from 127 degrees to 154 degrees. So this really suggests that the establishment was undercooking some of their oysters, and that is also an insufficient kill step for both Vibrio and Noro. So typically we'll see raw oysters, but that is the outbreak with the fried oysters that had been associated that we have in both either Vibrio or Noro. For our E. coli outbreaks, we had 11 multi-state outbreaks. So that included our cake mix, the kale spinach mix, leafy greens. We had 3 Washington outbreaks. And so for our multi-state outbreaks, it's contaminated raw product, but raw product that is intended to be consumed raw. So our leafy greens, produce items. And then we'll see cross-contamination and lack of sanitization for our Washington outbreaks of food that was intended to be consumed after a kill step. I'll go into I'll highlight an E. coli outbreak later on in the presentation. Okay, for our Salmonella outbreaks, we had 6 in 2020 and 4 of them were multi-state. In 2021, we had 5 and 4 of them were multi-state. One outbreak in particular, there was 8 people who felt ill with suspected salmonella infection. And, these 8 people, they did not get clinical tests either. So it's a suspected infection after ordering takeout of pork and chicken banh mi sandwiches. So an environmental assessment identified cross-contamination and improper cleaning and sanitizing of that facility. And this facility also had very limited space, so it presented challenges for this establishment to prevent cross-contamination. So the control measures for this one included requiring cleaning and sanitizing, but also behavior and procedure change in order to operate in a facility with such limited space. but to be able to prevent cross-contamination from occurring so it prevents other outbreaks from happening. For our Campylobacter outbreaks, we had 3 Washington outbreaks, 2020 and 2021. We saw chicken products, raw milk, and then these are the contributing factors that were related. So contaminated raw product that is intended to be consumed after kill step, insufficient cooking, temperature control. So I'll touch on an outbreak, Campylobacter outbreak later on as well. Okay, for our bacterial toxin outbreaks, so this would be our Bacillus cereus or Clostridium perfringens. We had 3 that were reported in 2021. One in particular, there were 5 people that fell ill after a suspected bacterial toxin after consuming various foods, including almond chicken, sweet and sour pork, and kung pao chicken. So the environmental assessment found the overproduction of food prepared in advance. And the contributing factors identified included no attempt made to control temperatures after cooking such large volumes of food, extended time for food preparation that supported pathogen growth or pathogen proliferation, as well as improper and slow cooling, because these products were cooled in these large tubs that were stored in an already overstocked walk-in refrigerator. So with that improper slow cooling, it really allows the pathogens in the food to proliferate. So control measures included discarding the food and then changes to their operational practices. For our chemicals and other category, we had one in particular because we don't see this contributing factor often, and it's substance accidentally added. So with this outbreak, there were 2 people who reported symptoms of mouth numbness and burning in the throat. They eventually also had kidney pain and brain fog. But these symptoms started immediately after consuming a coffee drink. So an environmental assessment found that the chemical solution used to clean the specific coffee machine was actually not properly rinsed out between uses, and it ended up contaminating the drink. So the chemical that was used to clean this machine contaminated the drink. So the control measures for this one were to ensure proper cleaning procedures of this machine, and this and was followed up with the chain as well. So ensuring that these practices are followed not only at this location, but across their other locations in their chain. So again, substance accidentally added is not one that we see often at all. For our Listeria outbreaks, both of them were multi-state. So we had one in 2020 and one in 2021. Both of them were multi-state. So this was contaminated raw product. And so the foods were the enoki mushrooms and leafy greens. We can guess that with our multi-state outbreaks that where prepared can be a private home or even at restaurants. However, the way CDC reports some of their multi-state outbreaks, they leave it as an unknown under where prepared. But we can guess that it was either at private homes or even in restaurants for those enoki mushrooms. And then for our Vibrio outbreaks, we had one in 2021 with 21 cases, 13 were lab confirmed, and it was contaminated or like a polluted growing area. Raw oysters were associated with that one. And then again, with the fried piece on that outbreak, that could be Vibrio or Noro. So that's where we are on our pathogens and some short stories there. So we're moving into a 10-minute break here. So I will go ahead and let everyone take a quick break and we can resume at 10:52. Okay, so now we are at our highlighted outbreaks. So I'm going to cover two outbreaks with just a little more detail of the outbreak stories and lessons learned. So we have our chicken liver moose outbreak from 2020, and then we have a yogurt outbreak from 2021. So let's start with our chicken liver moose. So this was a not so lovely Valentine's dinner. It was a Campylobacter jejuni outbreak that was associated with chicken livers. On February 24th of 2020, Grays Harbor County Environmental Health was notified of a Campylobacteriosis case. And this case was hospitalized and reported eating at a special Valentine's Day dinner at what I'm going to call Restaurant A. Excuse me. And then there were two more Campylobacteriosis cases that were reported. And these two cases also reported consuming a similar meal at the same Valentine's Day dinner. So as part of the epidemiologic investigation, a record of restaurant attendees was collected to find additional cases. So interviews were conducted with 49 restaurant attendees, of which 25 were ill with gastrointestinal illness. 45 out of 49 attendees ate at the restaurant on the evening of Valentine's Day. And then the remaining 4 ate at the restaurant after Valentine's Day. A case control study was conducted to identify the food items served during this dinner that may be associated with a more increased risk of illness. And so food history information was collected from attendee interviews that was used for the analysis. The food item with the highest difference was identified as the chicken liver moose appetizer, where 78.3% of restaurant attendees who felt ill reported eating chicken liver moose, and then 25% of non-ill attendees reported eating this item. And then 2 foods were found to have a significant risk of illness. So chicken liver moose appetizer and the filet mignon. So with the environmental assessment, Grays Harbor County, after using that information from the EPI investigation on the increased risk of the chicken livers, conducted the environmental assessment. And so this here is the picture of the food flow that was created by Grays Harbor County during the assessment to really assess the process of how they're making this chicken liver mousse. So to explain what a food flow is first, I guess we should start with that. It's a systematic review that describes the flow of foods or items that were involved. And it's a flow through the establishment from receiving to service. It's really to be used as like an evaluation of the processes, to also identify risks and contributing factors that led to that outbreak. And the key part for food flows is to explain how the food was made, not how the food is supposed to be made. And so it's really to highlight how the food was made at that time. So I'm going to go through, it's kind of a little blurry. So I'm going to go through just their process on how they made this. So the fresh chicken livers were purchased from a grocery store and was transported back to the restaurant, Restaurant A. And then they were stored at room temperature upon delivery to the establishment. For the cook step, once they got to there, chicken livers were seared in a large saute pan, and they were seared in the whole form. Spices and liquids were added, and then it was simmered. And then the chicken livers were removed from the heat and then immediately placed in a food processor to make the mousse. And then the mousse is then placed in stainless steel pans uncovered on the top shelf in a two-door stainless cooler to cool overnight. And so those steps occurred on February 13th. And then on February 14th, the chicken liver was then, the chicken liver mousse was then divided and placed in the under-counter prep top fridge. So for service, the mousse was then removed from this under-counter fridge and placed on the countertop for a duration of 5 hours for their dinner service. And so their chicken liver mousse was then served with filet mignon, a beef tartare, as well as duck. The mousse was also served as an appetizer and was served to most guests attending that dinner. And then the remaining mousse was served for a full week with other entrees and in to-go containers. And that was until February 21st. So that's the process on how they made it that day. So let's go back and kind of point out the risks that were identified and the contributing factors. So we're seeing these orange bubbles there. And so there are risks of cold folding, hand washing, cross-contamination, cooking, cooling, room temperature storage, cross-contamination. And so going back through then again and looking at contributing factors, it was determined that a food thermometer was not used to take internal temperatures of our chicken livers, as well as the excessive room temperature storage. So the contributing factors ended up being a contaminated raw product intended to be consumed after a kill step, no attempt to made to control temperature, and insufficient time and temperature control during the initial cooking process. So after discussion with the food manager, it was found that the chicken livers were purposely undercooked and appeared pink after being removed from cooking. And during the investigation, food thermometers could not be located during the investigation, and food workers were not trained to measure cooking temperatures. Additional risks that were identified also included this Valentine's dinner had menu items and specialized processes that were not approved with the establishment's plan of operation. The menu consisted of multiple raw animal species that were intentionally undercooked or served raw, and a consumer advisory was not included on that menu. Other risks identified were food workers were actually observed simultaneously rinsing raw oysters in the produce sink while raw produce was located on that drain board. Raw meats were not stored properly according to their cook temperatures. And with the plating served for the Valentine's Day dinner, all entrees were served or plated on the same surface without proper cleaning or sanitizing. There was also bare hand contact with ready-to-eat foods, and there was a lack of paper towels at the hand washing sink. So we were seeing, hand washing, cross-contamination, the cooking step, the cooling step, room temperature storage. So those were additional risks and the contributing factors. So for control measures, a hold order was placed on the food processor that was used to prepare the chicken liver mousse. And then there was also an environmental sample that was taken of that processor, like the cavity of that processor, but that sample was ultimately not tested. But a hold order was placed on that equipment. Unapproved sources of wild game that included elk and duck were processed and vacuum sealed for personal use in that kitchen. So wild game was removed from the establishment. Uncleanable equipment was discarded. And for this establishment, the food and beverage permit was suspended, and the establishment was closed, and they were required to attend an administrative hearing with the health officer of the county. They were placed on a risk control plan to address the behavioral and procedural factors that contributed to this large outbreak, in addition to the other high-risk factors that were discovered during the environmental assessment. They were approved, so Restaurant A was approved to reopen. The hold order was lifted on March 10th. So after thoroughly cleaning and sanitizing their establishment and demonstrating compliance with the conditions, they were approved to reopen. So a major lesson learned in this outbreak is the need to educate on the risks associated with poultry liver products. Our food service professionals and our regulators need to understand that poultry liver products need to be treated like poultry because it is poultry. So sharing this story, and there's been other similar outbreaks on poultry liver or poultry products, poultry liver products that have been in other outbreaks across the US. So sharing this story and other outbreak stories will help inform our industry of the risks and as well as the processes to control to prevent future illnesses associated with this product. So I do know that there are resources out there now that explain, proper handling procedures, ensuring proper cook temperatures, preventing cross-contamination on our poultry liver products, and the need to treat them like regular poultry because it is. One of the strengths of this investigation was the coordination and communication of the partners that took place. And then the acknowledgements. So we do want to say thank you to those who worked on this outbreak and solving this outbreak and preventing future illnesses. The control measures implemented were strong, which prevented other outbreaks from occurring at this facility that we know of. All right. Excuse me. All right, so our next one is our yogurt to be kidding me presentation. And so this one is an outbreak of 2 E. coli serotypes from an unlikely source. Apologies for the dog. All right, sorry about that. Okay, so during the last week of April in 2021, Public Health Seattle and King County was notified of 6 Shigatoxin producing E. coli cases among children. So this was alarming because it represented a 300% increase above baseline for STEC cases. And we were concerned, extremely concerned, because these cases were among children and they are at a higher risk for hospitalizations and hemolytic uremic syndrome, or HUS. So King County started to review the routine interview data for cases and found a signal for organic foods and produce, including leafy greens, avocados, strawberries, and dairy products. There was also a strong signal for what we're going to call Grocery Store A in this story. So Grocery Store A is a chain of natural and organic food co-ops, but they're not highly reported as a food source for our enteric cases. All but one of Grocery Store A's locations are in King County. So we began collecting shopper card information so that we could review the purchase histories and start conducting product traceback. So from the initial interviews, many families reported consuming organic foods and shopping at Grocery Store A. And at that time, King County was focused on produce signals since leafy greens and fruit have been culprits of 0157 outbreaks in the past. And upon request, the Washington Department of Health and the Washington State Department of Agriculture traced back several organic produce items initially in question back to 3 distributors. So our strawberries, avocados, and leafy greens. Each item was in a wider distribution that was not unique to the common grocery store A. And testing was also requested from King County on these produce items. So while this was occurring, Washington Department of Health began prioritization of STEC cases for whole genome sequencing. So at this point, there were 7 STEC cases reported by King County. And I do want to make a note that during this time, there were no other multi-state STEC cluster investigations, nor were there other Washington counties reporting increases in their STEC cases. So our partners at the Washington State Public Health Laboratory, or our PHL, were able to return the whole genome sequencing results quickly. The results allowed us to remove background noise. And so taking a look here at this epi curve, the grayed out cases there were actually ruled out based on those sequencing results. The results also revealed a case that was linked to our outbreak that resided in Snohomish County. So this officially made it a multi-county outbreak where the State Department of Health leads the investigation. On May 4th, King and Snohomish counties released public notifications on their website to alert the public that we were investigating an STEC outbreak of an unknown source. And then shortly after this media notification, the Washington Rapid Response Team from the Washington State Department of Agriculture coordinated interagency calls with local, state, and federal partners. And the Department of Health deployed a focus questionnaire, obtained shopper card records, as well as reviewed product distribution. And we also analyzed these purchase histories dating back up to 3 weeks before symptom onset for in-common food items from grocery store A. So during the analysis of our shopper card histories, we noticed a common item, a pasteurized yogurt product that was sold under the grocery store A label. And from the 6 shopper card records collected, 5 of them contained at least one purchase of this product. The case who did not have the yogurt on their shopper card independently reported consuming the grocery store A brand yogurt. Excuse me. So when Washington Department of Health and the Washington State Department of Agriculture reviewed the distribution of grocery store A brand yogurt, we discovered that this product was produced by a firm that we're going to call Producer A in the story. So Producer A was a dairy farm and small-scale producer of pasteurized yogurt with distribution only in the state of Washington. So 90% of Producer A yogurt was relabeled and sold as grocery store A brand, and 10% of Producer A yogurt was distributed to other retailers under the Producer A brand. So basically, grocery store A brand yogurt and Producer A brand yogurt were the exact same product. They were just sold under different labels. And so the vast majority of Producer A yogurt ended up being sold as grocery store A brand label. So over the next few days, we added additional cases from Benton, Clark, and Walla Walla counties to the outbreak through whole genome sequencing. 12 of the 14 primary cases reported consuming this pasteurized yogurt product from Producer A. 11 had consumed grocery store A brand yogurt, One Clark County case reported regular consumption of Producer A brand yogurt. One case in Walla Walla reported Producer A brand milk, but didn't consume any yogurt from Producer A. And then one case in Benton County had a caregiver who reported purchasing Producer A brand yogurt, but was not positive the case consumed it. So it was a caregiver who reported that. So even though these additional cases were outside the radius of Grocery Store A, they all had links to Producer A. So as a result, Producer A initiated a voluntary recall and posted messaging to their website. And this was on Friday, May 14th of 2021. After a few days, a few days after the recall was announced and initiated, we received a surprising development from the lab. There was a case from Arizona who now had an isolate matching the outbreak strain of E. coli 0157H7. So state and local partners in Arizona interviewed their case and discovered that they had recently been in close contact with visitors from Washington. At least one of these visitors had been recently ill with E. coli symptoms around the time of that trip. So our Washington local health partners reached out to these visitors for interview and learned they regularly consumed Producer A brand yogurt. So we concluded that the Arizona case was a secondary case and epi linked to this ill individual who consumed this recalled product. And subsequent Arizona cases were linked in the same way. It's really not often that we're able to draw such clear epidemiologic links, but because of the collaboration of multiple jurisdictions, we were able to piece that puzzle together. So in case you thought this couldn't get any more complicated, we also learned that 2 of our cases were co-infected with E. coli 0157H7 and 0103H11. And so here we have what we call dendrograms that our public health laboratory produces to show the relationship of our cases. And so we have the 0157 isolates that are highly related to each other. And then we have our 0103 isolates that are related to each other. So we see that here. And then this is our epi curve, and it includes our primary, secondary, and probable cases. And then for here, the onset dates ranged from December of 2020 to May of 2021. And so as we expanded sequencing, we found additional cases going back to December that had originally been excluded temporally. And so because these December cases, we were able to determine that they were a household cluster. And upon reviewing their interview, they reported shopping at Grocery Store A, as well as consuming this recalled yogurt product. So we believe that these December cases likely represent a sporadic issue with the product, while a larger event at the producer occurred more in March and April timeframe. And it is possible that there may have been ongoing contamination at the facility, but we were unable to confirm that suspicion. So overall, there were 17 confirmed cases and 9 probable epi-linked cases from 7 counties in Washington and Arizona. Ages range from 0 or infant to 71 years of age with a median age of 8. 11 cases were hospitalized and 5 developed hemolytic uremic syndrome, or HUS. And thankfully, no deaths were reported. So the E. coli 0157 and 0103 illnesses were linked to this pasteurized yogurt product from producer A. And although we had extremely strong epi evidence, we were never able to get a positive sampling results. So the Washington State Department of Agriculture conducted an inspection of producer A, a working farm with dairy cows, and they had a movement of workers between the farm and the processing areas. And this firm produced pasteurized milk, as well as licensed unpasteurized milk. And these processes actually took place in separate buildings. So during the inspection, there were sanitization, pest control, and equipment design issues that were observed. And the firm also used this unapproved straining technique that potentially exposed the yogurt to environmental contamination. And then the storage of yogurt containers were also in an unprotected environment. Producer A was given notice prior to the WSDA inspection, the Washington State Department of Agriculture, their inspection team. So the producer actually shut down the production and they cleaned the facility beforehand. So environmental sampling results were likely to be negative. And so the team, the WSDA investigation team, was also not able to observe the firm in full-scale production because they had closed before the inspection took place. Sampling conducted by the Washington State Department of Agriculture included our 50 strawberry spinach samples, 18 finished product samples, water samples, as well as 40 environmental samples that were collected. The FDA lab, the WSDA lab, and the Washington State Public Health Lab tested a variety of yogurt and milk products and performed environmental sampling. Unfortunately, 0 environmental or food samples tested positive. Here is just the table of the samples that were tested over the course of the outbreak investigation. So one of the most important lessons learned during this outbreak was pulling in our partners early. We were able to really leverage all of our resources, track down possible leads. And one of the other strengths of this investigation was the coordination and communication that took place. So Washington State Department of Agriculture's Rapid Response Team, or RRT, they did a significant amount of coordination for the investigation. So we had regular meetings with them that included our local, state, and federal partners. And so this actually really helped reduce the confusion among partners. It improved transparency and efficiency of sharing information. We also had a great cooperation from our retail partners as well. Every store participated in the recall. So every store participated in the recall, and grocery store A was very supportive of the investigation. So some challenges that we faced during this investigation included the different abilities to disclose and share information from state agriculture. So really it's due to the nature of their work, as well as confidentiality agreements in place. Challenges that we face, it hinders information sharing. So that's a lesson learned, but some challenges as well. The fact that there were no environmental or food samples that tested positive was unfortunate. because we would have loved to complete the three-legged stool outbreak investigation analogy, right? So that was unfortunate. But the epi and environmental evidence to suggest this product was the source of the illnesses was very strong. And then in addition to balancing the need to provide accurate, relevant information with transparency, it can be challenging. So we do our best to maintain public trust and relationships with our retail partners while recalling quickly and keeping people informed. So it's really a delicate balance. So acknowledgements for this outbreak investigation. So we want to acknowledge all of these individuals here jumped right in, worked diligently to solve this outbreak. We sincerely want to say that it would not have been possible to solve this outbreak and recall the contaminated product within 3 weeks of initial detection if it had not been for the collaboration of these partners. So thank you. So now we are at the question portion. So I do want to also open it up. I believe some of our investigators who investigated these outbreaks may be on the call. So I do also want to open it up if they want to share more of their outbreak stories to some of the stories, the short stories that I shared. So I do want to open that up.
Yes, we definitely have a lot of partners on the call today that did participate over the last 2 years and before that as well with a lot of the outbreaks. And as you mentioned, Milay, they're on the front lines for identifying the outbreaks and then making sure they get resolved. So if anybody wants to contribute some of their stories and lessons learned that covered what Milay also talked about today, that'd be great. We do have a couple of questions though, as we wait for people to potentially go off of mute. This was early in the presentation, Milay, so it talks about the information where cooling is a factor, that it could be used by local health jurisdictions to look at refrigeration size and the number of meals sold. So kind of using the lessons learned and actually having them impact and change potential plan review and evaluating that way. Do you want to make a comment along those lines?
Yeah, so with the cooling factor, it's one of our top risks for foodborne illness. So assessing that with our, risk-based inspections as well will really prevent illnesses from happening when we address those types of observations during our inspections. That answer the question?
Yeah, I think so. And so it's very important, right? We use those during inspection, so live action, but also using it going forward. And a lot of our code sections have changed where we do require some additional equipment or materials during plan review. And it's because of the lessons that we've learned historically with illness outbreaks. So great call out there, Jennifer. And Doug, it sounds like he's ready to go off mute.
Thanks, Susan. Yeah, I just wanted to mention too, being so involved with the Aztec outbreak associated with yogurt, that it was just amazing to see this cross-jurisdictional cooperation, everything from really when Randy Treadwell was still with WSDA and leading RRT, just the amount of work he put in to do it daily. And I'm forgetting the ICS form number specifically, so pardon me, but really doing a daily briefing, which really, had a nice chronological listing of what we had worked on, because this spanned a fairly long period of time. And so that was extremely helpful because then, you had a source you could go back to and understand where you were and where you needed to go. And then the DOH food safety team really did a nice job of creating forms when we did recall verification. I know for us at King County, we visited over 40 retail establishments to do recall verification of yogurt. So that's a significant amount of work. And I know many of you other local health jurisdictions also did recall verification work. And so the forms that were created on behalf of the DOH food safety team were extremely beneficial so that we didn't get mired down in that. We could actually go out in the field and do the necessary work that needed to be done. So it was interesting and amazing to watch it all sort of come together and how it sort of evolved, not knowing what were the responsible foods at first, and then discovering something that hadn't been readily evident. So it's a great case study.
Here, here. Thank you, Doug. And always thank you for you and your team and all other local health jurisdictions with boots on the ground. It's a lot of effort. So whatever, all the partnership can hopefully help each other. There's definitely a lot of work. One of the reasons why we so focus, we really enjoy listening and learning about the lessons learned from outbreaks, but this is why we focus so much on prevention, because they are a lot of work when you actually, unfortunately, have a cluster of illnesses and try to get it resolved. So we had quite a bit of discussion too in chat, Milay, about why is chicken liver potentially undercooked? So whether it's required to be undercooked or if it's just an undercooking concept. I think we covered it a little bit, but if you want to speak at all about chicken liver mousse, traditionally it is a cooked product, but it is often undercooked. Not necessarily on purpose, just might be a gap sometimes.
Yeah, I think it's a gap, and I believe it's the texture and the taste of the product as well. But there has been guidance that have been shared after many poultry liver product outbreaks have come that you can and need to cook it to proper temperatures to make this product. But I believe it's really that texture and taste that the industry has thought that it needs to be undercooked. I don't know if others have.
Okay, so we have a couple more questions, and then we will be capturing the rest of it through maybe through a printed means. But how do you get, Milay, most of the information? So you talked about a lot of information that you uncovered during these illness cluster investigations. How do you get most of the information? Is it through interviews with staff, or can you speak a little bit about all the different avenues that you get information for during an investigation?
Yeah, can you repeat the part on interviews with staff?
Yeah, is that one of the ways that you get the most information during an illness investigation, is actually interviewing staff, or is there other sources of evidence that you'll use?
Oh, yeah, so we will interview cases to get their exposures, their symptoms, nail down exactly what they ate when they ate. So a lot of case interview data, but also during the environmental assessment of working with the people in charge of the facilities and asking staff, how is this process made? Tell us a little bit more on how this was done, and really building that relationship in the facilities to really gather the information to be able to evaluate the processes and be able to link it back on the contributing factors that have led to it.
Okay, definitely a lot of inputs when you're out there. So it's not just one source for sure. We have one final question about the yogurt outbreak. So did anyone check the pH levels or acidity of the finished product? It's odd for Aztec to grow in properly cultured dairy.
Yeah, I'm actually not sure on the pH levels or the acidity on that product, so I can get back to you on that. But with the products from the investigation, with the straining technique that they used, it was an unimproved straining technique, as well as there was environmental contamination that was potential for that.
Yeah, and Phil kind of chimed in with that. It was probably more the contamination angle rather than actual proliferation. If we're using all the contributing factors, in this case, it was just contaminated. It didn't necessarily need to grow. It was just present. All right, I think that wraps up our questions. Thank you so much, Milay.
Thank you all.